name is Madhav and welcome to Gyanshala with masti. आज हम बात करेंगे ऑल अबाउट कोरोना वैक्सीन और हम इंडिया में जो कोरोना वैक्सीन दी जा रही है उनके बारे में बात करेंगे और वो बनती कैसे है। तो आइए शुरू करते हैं। पहले बात करते हैं कि कौन सी वैक्सीन दी जा रही है इंडिया में कोविड-19 के लिए। तो आपको पता होगा कि दो वैक्सीन है और उनको इमरजेंसी अप्रूवल दिया गया है इंडिया के इम्यूनाइजेशन प्रोग्राम के लिए। तो वो है सीरम इंस्टीट्यूट्स कोविशील्ड एंड द डोमेस्टिक प्रोडक्ट कोवैक्सीन which is developed by the pharmaceutical company Bharat Biotech. You can see the photos. This is the Covaxin and this is the AstraZeneca Oxford vaccine, which is developed by the Serum Institute of India. So these are the two vaccines and these are given in India for defeating COVID-19. So let's see that when vaccination started. So vaccination started on 16 January and it is nationwide vaccination drive. So let us talk about who will be vaccinated and how many people have been vaccinated till date and in the future. So approx 7.86 lakh people have been vaccinated till 20th Jan and till July approx 30 crore people will be vaccinated. So these are only 30 crore people and our population is 120 crore. Approx 120 crore, it can be less or more. So who will be given vaccine? So the first preference is of the health workers and the frontline workers. Then of the people who are above 50 years of age and the people who are having cancer and asthma problem, which are more prone to coronavirus, so they will be given. And if they are less than 50 years also, then also they will be given. So they will be covered under 30 crore. So we will also get, but our preference is the fourth, fifth preference. So let's talk about a very current topic that about vaccine, that is, are side effects of vaccine? So yes, there are, and there are very less side effects. Like COVID, we can say COVID vaccines are safe. Only 0.18% adverse reactions, which is same as side effects. So the common side effects if you have been vaccinated. So redness, tenderness, pain at the site of injection, the feeling of being sick or unwell, and one more side effect is fatigue, headache, chills or feeling feverish, nausea, muscle pain, body pain, joint pain, other flu-like symptoms like runny nose. So these are the common side effects. Now let's talk about some uncommon side effects, which are feeling dizzy or decreased appetite, abdominal pain, excessive sweating, or itchy skin or rash. So these are the side effects of corona vaccine, but they are very safe and only one or only 0.18% adverse reactions are there. So they are safe. So let us talk about how does a vaccine work. So vaccines greatly reduce the risk of infection. This we all know by training the immune system to recognize and fight pathogens such as viruses or bacteria. So COVID-19 is a virus. You all know. Vaccines safely deliver an immunogen, which is a specific type of antigen that elicits an immune response to train the immune system to recognize the pathogen when it is encountered naturally. So this definition is very tough. So let's understand it by a very simple definition. So one more question is there, that why vaccine require two shots? So here the proper definition is given, that very simple one. The first shot helps your body recognize the virus and gets your immune system ready while the second shot strengthens that immune system response or system. This makes your body more prepared to fight infection. So when you are given the shot of the vaccine, your some antigen is given, which is a small part of the virus or a weakened form of the virus, and when we put that in the body, our immune system sees that something has come in our body and it fights it. So as it is the weakened form, it does not affect our body very much. But our immune system learns that how to fight the virus. So here in the case of the coronavirus, they might be giving a small part of the coronavirus like protein or sugar. So or they might be giving a weakened form of the virus or inactive form of the virus. But that doesn't mean that your immune system can't recognize it. It can. So it kills it and finds the correct weapon for killing the coronavirus. And when we give the second time, it strengthens our immune response that if first shot hasn't worked, so second shot can strengthen it or it can more strong and more strengthen it. So this is how vaccine works, and it requires two shots. So here you can see how vaccine is made. The antigen you can see, I will tell you all the definitions of all of these. So we need antigen, adjuvant, preservatives, stabilizers, residuals, surfactants, and diluent. So these are needed for a strong vaccine. So let us see what is an antigen. As I told you, all vaccines contain an active component, the antigen, which generates an immune response or the blueprint for making the active component. The antigen may be a small part of the disease causing organism, which is the virus in this case, like a protein or sugar, or it may be the whole organism in a weakened or inactive form, as I told you earlier. So let us talk about now preservatives. Preservatives prevent the vaccine from becoming contaminated once the vial has been opened. If it will be used for vaccinating more than one person, then we have to add preservatives, or there is no need for preservatives. So let us talk about stabilizer. Stabilizers prevent chemical reactions from occurring within the vaccine. So, like if there is reacting between, if something is reacting between the virus, the antigen, or something, so stabilizer stabilizes it and it prevents the chemical reactions from occurring within the vaccine and keeps the vaccine components from sticking to the vaccine vial. So stabilizers can be sugars like lactose or sucrose, or it can be amino acids like glycine, and it can also be gelatin or protein. So let us now talk about surfactant. Surfactants keep all the ingredients in the vaccine blended together. They prevent settling and clumping of elements that are in the liquid form of the vaccine. So you might have seen that this is added to ice creams also, so there is not clotting of the milk or something like that. So it does not, it prevents the clotting of the things in the vaccine which are in the liquid form. So let us talk about diluent. A diluent is a liquid used to dilute a vaccine to the correct concentration immediately prior to use. The most commonly used diluent is sterile water. You can see the image of sterile water. So, if you might have heard in the news that there are phases that first phase of the vaccine has been done and phase 2 trial is been going on, so like this. So what is this phase 1, phase 2, phase 3? So here you can see all these small figures are humans. So in the phase 1 they test it on a small group of people, then in this phase 2 they test it in the bigger group of people, and to check that if there is no adverse reaction. And in phase 3, you can see there are so many people. So in phase 3, much more bigger group. And if all these phases are successfully passed, so the vaccine is approved for broader use for all the people. So this is how a vaccine works and its trials are done. Hope you liked my video. If you liked it, please like it and share it with everyone. And I bring these types of videos. So if you like them, please subscribe to my channel. So bye.